I'm going to start. The meeting just as a matter of formality. This is the September 18th, 2024 briefing of the Aging, Social Services, and Disabilities Committee of Community Board 6, Queens, covering Rego Park and Forest Hills. My name is Bruce Grossberg. I'm the chair of the committee. I'm going to talk a little bit about myself, introduce myself, and then I'd like the three of you to introduce yourselves. I just want to mention once again, especially for Alex, that you can say as much or as little as you care to say. But I will say this, my name is Bruce Grossberg. I'm the chair of the Aging, Social Services, and Disabilities Committee. This is my 8th year on the community board. I am a lawyer, although I'm not a lawyer anymore because I'm on disability. I've been on disability for quite a number of years. I'm 66 years old. I'm 65 years old. I'm 66 next month. And also I am a standby guardian for my brother, who's in a group home for the developmentally disabled in Suffolk County. So that's why I qualify, and that's why I'm here. And that's what I want to say right now. You guys could all say as much or as little about yourselves as you'd like, but Howard, would you like to go next?
Yeah, my name is Howard. I joined the community board 2021, and I've been on the community board for the last 10 years, and I enjoy it. Thank you.
John?
Yeah, hi, I'm John Dereshevsky. I'm actually not a member of the committee, but I wanted to sit in on it. I'm the board's parliamentarian and chair its bylaws committee. I have been on the board since, I guess, 2004, so it makes me, I guess, old blood or a veteran, no matter how you want to say it. And, I'm interested in the work of the various different committees, and I wanted to, check in on this and see it. And I just as I would, encourage board members to not only attend their own committees, but others as well. So that's that.
Thank you, John. Alex is our public member.
Yeah.
And why don't you talk a little about yourself, whatever you want to say, and I'll talk about public members, what I understand about public members in a second or two.
Okay. Hello. Alex Chalakis. I live in Rego Park in the Crescents. I live with my mom, and she's 89 now, and she receives quite a bit of services from Department of Aging. And I think I applied last year for the year before I applied for a different committee, but I didn't get chosen, and I was surprised that I was able to get on this one. So hopefully I'll learn something.
Thanks very much for volunteering. Alex, how much experience do you have with the community boards?
This is my first time with the community board.
Tremendous. We're lucky to have you with us. Let me talk a little, really for the sake of the video, as much as anything else, about community boards and public members. Community boards are a function of a statutes or a series of regulations. There are approximately 66 community boards in New York City. Manhattan and Bronx and Queens and Brooklyn, I think, have 14 community boards each, and Staten Island has 10 community boards. And the community board 6, for example, represents about, which covers Rego Park and Forest Hills, represents about 120,000 people. And community boards, there are about 50 members on each community board. They're chosen, I think technically they're chosen by the borough president in consultation with the city council member involved. And community boards do any number of things. In my opinion, community boards mostly do um, what the members of the community board like it to do. But as a more technical matter, community boards, oh, we have one more person. Hello, Amit. Welcome. We've already started. I was talking about community boards in general, and then after I'm done talking about that, you'd like to introduce yourself, we'd like to hear about it. I was saying that community boards are in a lot of ways the function of the people who are on it, but they have at least three functions by statute or by regulation, whatever you want to call it. The first function is to oversee the delivery of goods and services in the community district, which, as I pointed out before, is Forest Hills and Regal Park. And the second is to act as a zoning board might in a suburb or something like that. We do pass on requests for zoning variations and for certain new buildings. There's a lot of zoning regulations in New York City, so we wind up voting on. We wind up not having a voice in some things that you would think we would obviously have a voice in, and we wind up voting on things that you wouldn't expect us to vote on. One difference, unfortunately or fortunately, between a regular zoning board and this community board zoning board is that our decisions are not binding, although they have whatever public relations effect they have and whatever community effect they have, but ultimately all the decisions we make wind up being passed up the chain. So, for example, in a case of a zoning regulation, it has to eventually be voted on by the city council, which may choose to accept or reject our advice. And the third thing that community boards are required to do as a matter of statute is to put together budget priorities for the community district every year, a process that we're in the middle of right now, and I'll talk more about in a few seconds. So, Amit, we've been talking, we've each introduced ourselves. You can or you can't if you want to. Where you're from, how long you've been on the board, how you came to be on this committee. And you don't have to talk very long, but if you would introduce yourself, I'd appreciate it.
Sure. Everyone, my name is Amit Pratap Shah. I'm new to the community. This is my first term. I started this April, 2024. And professionally, I've been in the healthcare industry since almost 2 decades. I did my public health bachelor degree and then master in healthcare management. I've been work with Columbia and then Medical Center and then also NYU Langone Health. Currently, I'm in the I work as a consultant as a home healthcare agency based in the Queens. So yeah, and I'm excited to working all with you. I've been passionate to work in the different community, especially related to health and then aging. So thank you.
Thank you very much, Amit. I just wanted to circle back one thing I did not say as it relates to Alex. So I said each community board has about 50 members that are appointed by the borough president in consultation with the city council members. And the 50 members all are participants in various committees. We're all on 2 or 3 committees, sometimes more, sometimes less. John, who's a member of the executive committee, is on several committees. Any community board member can participate in any committee meeting, although you can only vote for on motions that are brought by committees that you're formally a member of. We have public members that people are allowed to people sign up or volunteer to be public members of different committees, and we're not going to have a vote tonight, but if we were to have an actual vote on something, the vote of the people on the community board who are not members of this committee do not count, but the people of the public members who are on this committee do count. So so in that sense, your vote does matter when we take votes on various issues. So that's the end of introductions. I talked a little about community boards in general, and I also said on the, I don't know if you still have the agenda with you, but on the agenda, it says, item 2 is what does the Aging, Social Services and Disabilities Committee do? And I said something a little earlier that was a little bit glib, but I still stand by it. The Aging, Social Services and Disabilities Committee pretty much does what its members wish it to do. That's kind of a little too vague. I mean, we do have, for example, in theory, a formal relationship with the New York City Department for the Aging, where we're supposed to go back and forth. But the composition of the committee in the last several years, we haven't really gone back and forth with them very much. But that's a corresponding committee. We have other committees on the community board that do work that somewhat overlap what we do on the Aging, Social Services and Disabilities Committee. There's a committee for those without shelter. There's a public transit and a street safety committee. There's a mental health and substance abuse committee. There is a parks committee. There's a veterans affairs committee, and then there are occasional select committees. So we do have committees that overlap with what we do, but we do it as it's turned out over the time I've been on the committee. We do manage to pretty much stick to issues about aging, social services, and disability. Last year, and every year is a little bit different, but last year we were focused on nursing homes. We ran a webinar on nursing homes. We passed a resolution about nursing homes that I'm going to go through in some detail this evening, so we can take next steps. In prior years, we have been more focused on elder fraud, and we have a member of the committee who was very focused on that, who's still on the community board, not on the committee, although I spoke to her in the last day or two, and I know that she's committed to remaining not necessarily on this committee, but engaged in the work of elder fraud and those issues that relate to it. I sent you. I did not. I'm working on this. What do we call this software? WebEx. I'm working on this WebEx software, which I'm not very familiar with, but I did link. I don't know if you all got that long email I sent by way of introduction. I sent it originally, I think on September 5th, but I sent another copies as we've gone on. And one of those links is to the statement. I don't even know how this looks. The statement of community district needs and community board budget requests for the fiscal year of 2025. So the way it works is that we're in the middle of a real year fiscal. We're in the middle of real year 2024, but in New York City, the fiscal year for the next year starts on July 1st. So on July 1st, 2024, the city went into fiscal year 2025, and on July 1st, 2025, the city will go into fiscal year 2026, which I'll bring up again in a few minutes. And the reason why I have shown you this document, and you can go to the link in the email, and if you don't remember getting the email, I'll send you the link after the meeting if you want to. It contains information on the community, some statistics about the community district, and it's an 80-page document, but fortunately for us, the first 14 pages are devoted to healthcare and human services. As I mentioned to you, there are a number of committees that fall under the rubric of healthcare and human services, but we do a lot. And so, for example, on this statement here, it says that the top 3 pressing issues overall for Queens Community Board 6. Number 1 is schools. Our youth population continues to increase, and we don't need parents to relocate for better educational opportunities. Every child in Community Board 6 should have a seat in his or her neighborhood school. We have an education committee about that. But the next thing to say, the second pressing issue is senior services. Senior services need to be monitored as the baby boomer generation ages and the immigrant population increases. And then the third important thing is transit. Safe, reliable subway and surface transportation in this community is a major priority as opposed to people using their automobiles. So it's not a car driving place. It's more, they say, it relies very much on commuters. And then for homework, if you care to do it, on page 11 and 12, we point out the summary of the work of healthcare and human services on the community board. This whole document, this 80-page document, is an evolving document. We are required to submit a copy of it every year, and every year it changes slightly. It's our district manager, Christine Nolan, coordinates this. And if you decide you want to take a look at it and read it, and you have any comments to make on it, that doesn't necessarily need to be the work of the committee. I'd appreciate it if you wanted to make changes. It's also, if you want to make changes and just run it directly through the community board, you can do that as well. Another place for is the Queens Community District profile, which I also linked to, I believe, in the email. And one of the things there, as I said, there were, what did I say? I said there were 60 something community boards in Queens, and I think our population is the third or fourth oldest population in New York City, by community. And so we have all those issues that relate to aging. Anyway, so that's some of what the Aging, Social Service, and Disabilities Committee does. All I've done was talk, and I have more to say, but this would be a good time if anybody else has something to say. Please feel free to say it. Mm-hmm. Okay. Moving on then to the next item on the agenda, which is budget priorities. And I'm addressing this a lot to Alex and Amit, who are new to community boards and may not be familiar with what I'm about to say. And I hope that I'm not being too pedantic and stating the sky is blue too much for John and Howard. So the community, the committees on the community, I'm sorry, the community board as a whole is asked to submit budget priorities to the city every year, to the Office of Management and Budget. And it's basically a Christmas list, a wish list, whatever you want to call it, of ways we would like the city to spend money on us, on our neighborhood. And it is a wish list. It's an important wish list because we're required by law to provide it, and because people do read it. And things, and it creates ideas. It creates movement sometimes, and sometimes it creates action. Things move up the agenda. We focus on things at the top of the list, and sometimes things actually get done. So every year we put together priorities, and then once again that email I sent out mentioned which is another indication of what is we think of as being important. There are two different kinds of budget priorities that the city asks about. And one set of priorities is called capital priorities, and the other one is called expense priorities. And it might be an oversimplification, but I'll put it like this. Capital priorities means that something is getting built, that there's a thing at the end of the day, and that we want the city to pay for this thing, and that's a capital priority. And then an expense priority means that somebody needs to get paid to oversee a project. You need social workers, you need crossing guards, you need people to come in and coordinate something so that something can get done. Those are expense priorities and capital priorities. So, for example, once again, this is all in that memo I sent you. Our last year, our capital priorities, the things that I require things to be built, was senior affordable housing was the first, and elevators for the Long Island Railroad Station Square was second. The third were elevators for the subways. Fourth were to complete some of the street improvements where they seem to have left them in the middle, and to make sure there was some money put in so that can be built. Fifth priority was supportive housing facilities. The difference between a senior housing facility and a supportive housing facility is that supportive housing facilities contemplate other professionals being a part of the community. Where there's some medical services, there are definitely some social services, sometimes dietary assistance, so that it's not quite a nursing home, but it's a way to get services to create communities where as they call it, that you can age in place, where you don't have to leave when you turn a certain age because your income is beginning to trickle down and you need to live someplace else. And our sixth priority was other affordable housing. So just to talk about these capital priorities, so there's a number of committees on the community board, and every committee last spring created a list, and then through some weighted voting computer program, Heather, our chair of our community board, who's also a volunteer, and Christine, who's our district manager, who is an employee of the city, put together a list of priorities, and a weighted list, and then the community, and then last night, the chairs of the various committees voted to ratify the list, and then in October the whole board will ratify the list. Now, out of those items I mentioned 6 items. And out of those 6 items, out of those 6 items, 5 of the 6 items wound up on the top 10 list for the entire community board, which means that there's other interest in getting senior affordable housing and supportive housing and elevators and other affordable housing. It's a big priority, not just to the people on this committee, but to the community board as a whole. So hopefully that'll get people's attention when we vote on those things those things in October. As far as expense priorities go, things that require people, we voted for first a Meals on Wheel program, second for programs to help people age in place. We voted for more home services for the elderly. We voted for career training for seniors. We voted for transportation for the elderly, and we voted for more mental health services for seniors. And all of those, and 4 of those items made the top 15. Home services for elderly, Meals on Wheels, mental health for seniors, aging in place programs, all made the top 15. And a request for transportation for the elderly made the top 25. So the things that we're focusing on are things that the community board as a whole, whether they're on the committee or not on the committee, wish to focus on as well. And once again, it's a wish list. We submit it to the city. There's a number of other steps involved. And then the city comes back to us and says, we'd love to do it, we don't have enough money. Or we we'd love to do it, and we're slowly but surely putting together a fund to do it. Like when we asked for them to rebuild the library, which we've been trying to get the Rego Park Library built for the last 30 years, 30, and they promised us a groundbreaking by the spring of 2025, which is an update from the groundbreaking they promised us in the spring of 21, and an update from the groundbreaking they promised us in the spring of 18. Now, before that, I wasn't here, as I'm sure there was another promise or 2 made, but we'll see where we go. But one of the things about doing this exercise, as dry as I admit it can sometimes be, that does give you a sense of what's going on in the community board as a whole. It gives you a sense of what people are looking at, and may spur community board members and other people who are focusing on this to action. Anyway, I will now again talk the whole chunk, so this would be a good time if anybody has anything they want to talk about. I'm sorry, John.
I just wanted to say, I mean, just what you're saying, I think the budget priority process is an important one, and it's one which, I think it's a way in which you can learn a lot about the basic priorities throughout the district. And even though the board obviously doesn't have the power of the purse or anything else like that, it does provide a good list that we can really advocate both within the community with our elected officials. And I think, on the whole, I think we've been, reasonably successful in a number of areas. And it can be frustrating at times, but I think it also is an area where we have been able to represent the community in an effective manner. And particularly over the last few years, where I think the activities have been a lot more comprehensive and concentrated, I think we've been more effective.
I agree. And through this, I've been on the community board, as I said, for 8 years, which is not forever, but on the 8 years, at least I've seen, in my opinion, an increasing awareness of the problems of aging, which, to be honest, is obviously a function of the fact that the community is aging, and of course I'm aging as well, and also focus on housing, which isn't directly our issue, but it's our issue because the seniors, many seniors are homeless, but more to the point, seniors have a hard time making rent when their incomes get reduced. So those issues are, as I said, they're important to both the seniors and to other constituents in the community board. Okay, I'm going to move on unless somebody has something they want to interrupt me with. The principal, there's only a handful of us on each committee, and there's only so much work any committee can do. The principal work we did last year, as it turned out, we didn't even know this was going to happen until we look back on it, is that we got a lot of information out about the status of nursing homes and when the issues that nursing homes would face after COVID. We had a webinar that was, I wouldn't say any webinar was well attended, but it was well, the tape was looked at online by a lot of people after the fact. We had the webinar was the senator, our state, Adabo is our assembly person or our senator, John? I'm sorry.
Senator.
Our
Senator.
Senator Joseph Adabo, who participated along with a man named Richard Mollett, who's the director of long-term care. I'm looking for the acronym. I'm sorry. The Long-Term Care Community Coalition. I can never think of the word community. LTCCC, the Long-Term Community Care Coalition. And they run webinars. Actually, unfortunately, I'm sorry about the timing. They're running a webinar right this second on nursing home issues, which I'm sure will be posted on their YouTube page at some point. And the complaint they're making on that day, and the things that the senator was responding to, is the fact that you have the nursing home operators who say they're running on tight margins, and their financial statements, which do not always seem to indicate that, and you'll have a churn of nursing home workers. It's not considered to be highly skilled work, and the pay scales are so low that by the time they can make real money, they've gone on to other things, because you can only work hard work for low wages for so long. If you have another choice in life, you'll probably take it, which leaves a staff that's not always as high a level as it could be. So at the end, we passed a resolution. We, the committee, passed a resolution, and then the entire board passed a resolution in the April meeting, which was kind of a mixed thing. I was surprised myself that we were able to pass a motion like this. And we said, and I'm going to read it again for the sake of the newcomers and for the sake of people watching on the video. It says, I'll read this in relevant part. It says, whereas there's a need for improved oversight of nursing home care and rehabilitation facility care, combined with stronger enforcement of minimum care standards by the state and federal government. Whereas there's a need for improved state and federal staffing policies, increased salary and benefits, and clearly defined career paths. Whereas the personal needs allowance for residents and patients of nursing homes and rehabilitation facilities is insufficient for the actual personal needs of residents and patients and needs to be increased. I'll get back to that. Let me just finish reading this. Whereas there is a need for improving financial accountability and transparency for nursing homes and rehabilitation facilities, whereas there's clear documentation that nursing homes and rehab facilities are hiding profits. Therefore, let it be resolved that Community Board 6 calls for the Governor of New York and all state legislatures to address these issues prior to passing any increases for nursing home funding and rehabilitation facility funding. So the claim is that if you're in a position like my brother is, who's in a group home for developmentally different, and he gets a certain amount of money from the state, which he doesn't know anything about money. It goes to fund his services, and some people say it's insufficient, and other people say, how can it be insufficient when nursing home profits seem to be rising? And we said as a community board that we wanted the state to look into that before they gave massive increases to the nursing homes. Now, this is my personal opinion. It's problematic to do that because if you don't give the increases to the nursing homes, they're not going to pay their workers, and they're going to lose their workers. And on top of the fact they'll be short-staffed, the staff they'll replace them with will be inexperienced. So I'm on both sides of that issue. I think that I think everybody should make I think the nursing home owners are entitled to a fair margin. I think the people who work there are entitled to a fair wage and to the opportunity to make this a career if they so choose, with career paths and increases in salary as they gain experience. But at all events, even though we passed this resolution in April, the budget was also finalized in the spring, and we know that it didn't make a difference outside of the fact that we raised the issue. So now we have to go back. We have to go back now, which I like to do over the next few weeks. I would do it all tomorrow, but my schedule doesn't permit it. We all have jobs and lives. But over the next few weeks, I want to go back to our state representatives and see whether any progress has been made and what they're doing, and to the extent that anybody can brainstorm what we might be doing, or whether there are other parties, other groups that might want to be involved in this kind of oversight. For me personally, that's a task that I will spend some time working on over the next several months. Dr. Renee, welcome. Can you hear us?
Yeah, thank you. Sorry, I was having technical issues, wasn't able to get in.
I'm so not surprised to hear that. We've gone through the agenda. We've introduced ourselves to each other, which I'll allow you to do in a second. We've spoken about the generally what a committee like ours would do. We talked about our budget priorities. Just to make a long story very short, our budget priorities that we passed last spring are high on the list of the budget priorities for the entire community board. We had a meeting of committee chairs last night. Were you there? I don't even know if you were there or not.
Yeah.
Were you there?
Yes.
So anyway, I felt that our committee did very well on it. One way we did well, because since Renee and John were there, I'm not talking out of turn, is that we didn't talk much about these issues because they're already high on the list and nobody tried to knock them down. So I was very pleased about that. We talked about the statement of district needs and the community profile, which I sent along on my email I sent to you, that long email I sent a few weeks ago, and I sent again this morning. So I unfortunately don't have the tech skills to post on these WebExes or the chart or anything like that, but it's in that material if you wanted to look more at it. And then I just finished talking about the nursing home resolution that we passed in
We
the
passed
spring.
that last time. We did.
But we do have to start to do follow-up, and outside of the fact that I just committed to calling our representatives over the next several weeks. I'm open to suggestions as to how to make that point, how to move that project along. So now I think you're caught up. If you have any questions, of course, or comments, I'd love to hear them. We'd all love to hear them. But also, if you would like to introduce yourself to the greater or lesser extent, we and just, say your name and maybe a sense or two about why you are on a committee like this. I'd appreciate it. You don't have to, but if you can, I'd appreciate it.
Thank you so much, Bruce. Good evening, everyone. Sorry, because of technical issues, I couldn't make it before time. I'm Dr. Renee Mera, and I've been on the committee board since 2002, and on this committee for, I think, 2 years or perhaps 3 years now, and really passionate about working for seniors and providing them, navigating them, helping them to understand the resources that are available to them, because that's a very vulnerable community, and we in Forest Hills, in this area, we have a great population of seniors, and we want to see that we're addressing a lot of the issues, especially the one for nursing home resolution. I'm very interested to see how far it goes and what is the outcome on that. So that's pretty much it at this point of time. Thank you.
Thank you, Dr. Renee. So I'm for now done talking about the nursing homes. If anybody has, this is another point where before I go to the next agenda item, if anybody has anything to say about anything really that relates to the topic of our committee, this is a good time to say it. Going once, going twice. I'm going to move on to the next item, which are intergenerational webinars. The committee, our committee, is a co-sponsor. Right now, we're primarily a co-sponsor with Common Point Queens. We've had other co-sponsors through the years, and we co-sponsor a series of intergenerational webinars. We've done 3 years of these, 3 or 4 a year. We're expecting to do 3 or 4 between now and next September. And what they are is we typically have 3 seniors and 3 teenagers do a webinar where they discuss the issues of the day. We've discussed things like immigration. We've discussed things like health services. We've discussed gay pride. We've discussed media, and they've gone fairly well. Due to people shifting in and out of the committee, and our co-sponsors are shifting in around, I'm not exactly sure where the intergenerational webinar is going to go. I will say on a personal matter that it does take up a fair amount of my time. So when I talk about the nursing homes and I talk about the work I'm talking about with intergenerational webinar, especially if we continue another season of it, which is my preference, that's a fair amount of the time that I have to commit as a volunteer to this committee. On the other hand, I am willing to support and I'm willing to provide the time it takes and the resources that I can muster to support any other project relating to aging, social services, and disabilities that any of you would come up with either now or going forward. One of the reasons I put attention to all that material is in case you don't have something specific in mind, maybe reading some of that material would allow you to think of something. And you don't have to say it between now and the time we close the meeting. You know, you're always welcome to email me, and you're always welcome to email anybody on the committee, or to email Heather or Christine Nolan with any ideas that you have on how to expand the role of this committee, or how to work with other actors, other committees, or people outside of the community board to make things that you want to do done. So that's the end of that. I'm sorry. I expect to have another orientation meeting for the intergenerational committee sometime in October. I also want to say, as a general matter, that there are requirements on the community board that you serve on committees. There's no requirement that you serve on any specific subcommittee, including the one I just mentioned. But obviously, we'd like your help, and obviously, the thing doesn't work unless you work it on some level or other. So anyhow, once again, I'm done. Actually, I really am done talking. The only thing I have left to do is scheduling. So if anybody has anything to say about anything, this would be the time to say it.